Hi, this is Dakshayani Santasurban. In today's broadcast, we have a special guest, Dr. Priyadarshini, Senior Doctor Consultant Dermatologist from Colors Healthcare. Hi, Doctor.
Hi,
How are you?
I'm good. How are you?
I'm doing good. In recent times, there's a lot about health, skincare, hair, and no skin treatments. You can see the Instagram, nor the social media, whatever screams. You have lot of talks about skincare, hair, and all. So, in today we are going to talk a lot about skin and hair. So let's have a special session about skin and also hair today. So coming to hair, in today's generation, there's lot of pollution. At the same time, we have lot of problems when it comes to hair. Sudden hair fall, sudden hair problems, breakages, split ends, and you see I don't know whether it is because of the product or it is because of the pollution or it is because of the health care, our life certain circles. We have different types of working people when it comes to women. Few works in the base of industries, few work in 24 into 7 also. All these people have the same problem. What is it actually?
So, as you said, we have a lot of exposure right now. The exposure right now is very good compared to like 5 years back. So, this sudden hair fall, we call it as telogen effluvium in medical science. It's called telogen effluvium.
Telogen effluvium.
So, what is this telogen? There's a big buzz about it. So, this telogen is hair will have three cycles, okay, three stages. One is called the anagen, catagen, and telogen. We call it telogen because it's like sudden, abrupt shedding of hair. So this is one of the stage like every human goes through this. There'll be a growing phase for a person and there'll be a falling phase for a person. This telogen is the resting phase. That is
Oh.
each cycle of hair. Like your hair goes through 3 years of growing phase, 3 months of this resting phase, and 3 weeks of falling phase.
It's like people also taking rest.
Yes, it's like same way the hair also goes through these stages. So it's pretty normal. This telogen phase is quite normal and happens for every human being. But this telogen effluvium, this term happens when there is excessive shedding of hair after any metabolic event like a stressful event or a hormonal change, or when you go through a difficult labor, childbirth, or
Oh,
infections.
okay.
So there is no specific cause for it. There are a number of causes for this telogen effluvium, and it will have like a acute cause or a chronic cause.
What is this acute chronic? Does these things comes under you in a specific terms? What is this exactly, and what happens when this acute and chronic happens?
So as I said, this cause of hair we call it acute or chronic. What is acute is if it's less than 6 months we call it acute.
Then it's safer.
Yeah,
Oh,
yeah, acute is pretty
okay,
safe.
safer. Okay.
Okay, so this chronic, when the shedding is chronic, it happens more than 6 months,
Oh,
and it will have a very fluctuating course. See, when the hair fall is less than 6 months, it will have like a no, like a pretty normal course. It will be like you can predict what happens next when it stops. But this chronic course has a fluctuating pattern.
okay.
But one thing patients can feel safe about this telogen is they'll not go completely bald. Even if the hair falls in bunches, we usually reassure the patient's hair will grow back even after it falls because this is the resting phase, as I told
Half of
you.
the time when hair falls itself, patient will get heart attacks
Yes.
because every female, every male have a beautiful space when they have a good hair. Good
Yes.
hair is good day, and so many things are there about hair. When it has a phase of falling, it is hard for us to think. And as you said, lot of stress. What can be done to stop these kind of problems?
So we have like so when you don't want this telogen effluvium, you have certain things which can be done. You can get a like what we can do from our end is you can get a good sleep routine. You can take enough protein, and you can take the peptide hair serums.
Oh, okay.
Okay, and then you can take multivitamin which has biotin and iron incorporated in it.
So
These
these are in the way of intaking?
yeah, it's a intake. Supplement is what we take orally.
Okay.
And this peptide serums is when you meet a dermatologist, they will prescribe you a peptide serum.
Oh. So how long this affects?
So this telogen effluvium, as I told you, usually it has acute course. Luckily, this will be like in 3 to 6 months. It resolves on its own,
Okay.
usually, and it starts after 3 months. Usually, after a stressful event, when a patient goes through typhoid, malaria, dengue, or a childbirth. 3 months they'll not have any hair fall. Suddenly, after 3 months, it starts, and the patient will go into panic mode.
So, is this only for the certain people, as you said, child labor, sometimes before your no stressful event, or even after some health issues, you have these kind of. Is it common, or it is only for certain these people only?
No, it can affect anyone, the telogen effluvium, but whom it affects most commonly is women,
Oh,
and especially women of childbearing age group. Assigned female at birth is what we call these women. That is like those who go through postpartum. Most commonly, they are affected, and specifically, it affects women between 30 and 60 years of age. Maybe because of our hormones, estrogen, progesterone, hormonal changes, and stress, we are more prone for this kind of
okay.
issues.
So I think so. All the working women should be aware of this particular problem.
Yes.
And when it comes to the symptoms, we'll be able to see. We usually have hair falls every day when we comb or we do use some eat products. We usually have hair falls. But what about when it comes to telogen? Does it has a symptoms or it is just a direct attack?
So patients can usually like see if like 4 or 5 hair falls itself. Some patients will say they have hair fall. That's not called hair
Yeah,
fall.
I'm also such kind of
Yeah,
questions.
so we have to like ask the history properly. Is it like
Okay.
really a cause to be worried about? We have to find out that first. And usually 50 to 100 hairs per day falling is quite normal.
Oh,
Okay, this is the thing. When you should be alarmed is when you see more number of hairs on your hairbrush when you comb, or when your shower drain is filled with hair after a bath, and then or your hair is very dry, and if it's easily pluckable, then you can like meet your dermatologist.
oh. So obviously we can see all the air falls when it is too much,
Yes, you
but
and one more thing is telogen effluvium, your scalp will be pretty healthy.
oh,
As in, like, you will not have any itchiness, flakiness, or redness. So, that is a main component of this sudden hair fall, which we call it telogen effluvium. Even though there's skin thinning on the scalp, your scalp will be pretty healthy.
oh, the scalp will be healthy, but you will have hair falls. So this is
Yes,
kind of
yes,
drama then again
yes.
when it comes to
So,
us.
this main difference we say is to differentiate from other scalp disorders,
Okay.
like other seborrheic dermatitis or psoriasis or other conditions. When we take hair, we have a lot of issues. So, one main thing patient needs to be reassured is they have to check if your scalp is healthy.
Oh, so even though if the scalp is healthy, you will have hair fall due to this
Yes.
delusion. So what triggers actually? What triggers to the space for a hair
Okay.
fall?
So, as I told you, this telogen effluvium doesn't have like one specific cause. When we ask the history, usually we'll be able to find the cause which caused it. It can be after like a high fever, it can be because of like severe psychological stress when there's a death of a loved one,
Oh,
or it can be because of like medications. Patients who are on depression, they'll be taking antidepressants, this can cause it.
oh,
And some patients
okay.
who have severe acne, they'll be on retinoids, so that can cause it. Calcium channel blockers, beta blockers, the heart patients who take it, these patients, like medications can cause it, one of the cause. Other factors, PCOD can cause it, and after a childbirth, postpartum hair loss can cause it.
I think so. A lot of people nowadays have PCOD,
Yes.
and yeah.
And iron deficiency anemia, thyroid disorders,
Oh,
hyperthyroidism, hypothyroidism,
oh,
all
okay.
these factors can cause it.
You have we have lot of issues with this hair.
Yes.
Uh, do we have any dialogue done for this? For like you have anything that can any test that can be taken in process to find out this is what is happening, like home test or any physical test that can be taken.
So when you have like a alarming reason to, you have to check what it is. When there's like more than 100 hairs falling, and when your shower drain is filled with hair, one thing is you meet your dermatologist first. Don't self medicate. When you meet a dermatologist, usually with your history and examination of scalp, they'll be able to find the reason of this
Okay.
telogen effluvium. So first, they'll be doing a physical examination of your scalp, and we have a mission to look at your scalp. Like there's something called terminal hair density,
Oh,
vellus hair density. We'll find out with the help of trichogram.
okay.
There's a mission for the hair scalp. We'll do that, and we'll be able to find out usually with your history. And one more test we tell the patients to do is a hair pull test.
Hmm.
So, how we do this test is basically we tell the patient to grasp a bunch of hair with the help of your index finger, thumb, and middle finger from the scalp firmly. And when there's more than 10% of hair shedding, it's called active shedding phase.
Okay.
So, with this test, patients will be able to find out by themselves.
Oh. So, medications and treatment, will it be done even after the post? Is there any post care for this after the treatments?
Yeah, medications as in like we'll see the cause.
Okay.
Like if it's iron deficiency anemia, we have to correct the hemoglobin and start the patient on iron supplements. Or if the cause is thyroid, we have to correct the thyroid cause. And if it's postpartum, usually the patient resolves on own. After the postpartum phase, your hair is going to be normal. The specific cause has to be treated. Like stress means the patient should get enough sleep.
Oh, okay.
All these factors should be corrected. Or if the patient is on crash diet, we have to advise the patient to stop crash diet. You have to take healthy fats in your diet, whole grains in your diet, vegetables, and you should basically get enough protein for the hair.
Oh, okay.
All these factors we'll correct, and we can start the patient on multivitamins which have iron and biotin in it, specifically which is for hair. And medications, if you see, we give minoxidil. That is the gold standard treatment for this telogen. So this minoxidil, what it does is it will increase your hair follicles, as in like it will stop the telogen phase. It will make the hair enter the anagen phase.
Okay.
Anagen is the growing phase, as I told you. So it will increase your density of the terminal hair also. Basically, it's a vasodilator. It's a potassium channel opener. So we start the patient on minoxidil and multivitamins, and
So,
we give some serums as well. Like you'll be using serums, right? When you'll see online
yeah,
everywhere, you'll be seeing hair fall
hair fall
serums.
serums,
So
yes.
they have specific peptides in it, like redinyl, procapil, and all that. We start the patients on it.
Okay. So, will there be the patient will get any allergies due to this medication diagnosed stuffs?
Allergies specifically, there's nothing reported. Like, but some patients when they use minoxidil, they might have itching or stuff. Itching. That time we tell the patient, we shift the patient to some other medications.
Because beauty lies in hair sometimes.
Yes,
So,
beauty is greatly measured by hair. In
exactly.
our centuries and centuries, we measure beauty with hair.
That's the main reason why we all are very no ingrained to know about why this, what happens,
Yes.
what cause are these, because we will not know. Our lifestyles are very difficult to find out a pleasant, proper thing. Even the pollutions at the same time, proper care cannot be taken. So at the end, we need someone once like you people to come explain us what is this, why is this, how is this happening, and for what cause. And when we come for the hair fall, is it that we have to take some good intakes for this problem?
Yes, intake is like one of the most important thing to like control your hair fall. Like you have to get enough proteins, multivitamins, and include healthy fats in your diet, and supplements. All this is like very essential. Whole grains, you have to add walnuts in your diet, antioxidants in your diet. Antioxidants like tomato, which has lycopene, walnuts you can take. All these healthy food will like prevent your telogen effluvium, and you'll get back to normal in short run.
Okay. So is this procedure permanent?
So this telogen effluvium, as I told you, it doesn't have a normal course. It will have a fluctuating course, but it's not permanent. One thing we can
Okay.
reassure the patient is it resolves on its own even without treatment. Within 3 to 6 months, usually it has a temporary course.
Okay, we can see we can see through your wide eyes how about the regrowth of your hair.
Yeah, this one is like as I told you, within 3 to 6 months, you will have your baby hairs growing up, and within a year, you will get back to your normal hair.
So it'll take a year. You
Yes,
need some patience of
yes, you
time
need
to.
patience.
Oh, but at the same time, lot of procedures to be also be followed. So what if a person is very busy and cannot be followed? Will this have a serious damage after the treatments?
See, even if you're like not, if you're not following any treatment, some care has to be taken for hair. You can just spend 5 minutes for your hair.
Okay.
Though the patient cannot do all the procedures, we have quite a number of procedures for this telogen effluvium. Even in the dermatological clinics, we have a lot of procedures, but patient has to spend some time for the hair. If you want good hair, you have to spend at least 5 minutes in applying the serum or taking the supplements. Even if you don't want to spend like 2 3 hours in the clinic, at least take the supplements and a good shampoo, good hair routine, good serum and multivitamins, good food, and good sleep routine is a must for hair.
So what are the treatments that can be taken when we come for the consultations? What all the treatments do we have?
So when we come to hair, it's not like a specific treatment. I already told you about the medications we
Yeah.
do. So when we do a hair treatment, it's always a combined approach. So you have to take the medications as well, and you have to get enough sleep. You have to take a good enough protein, and you have many treatments. As you would have heard now, it's like quite trending. You would have heard about the PRP.
Yeah, exactly. I was about to ask you. We see all over the internet about PRP, 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 PRP. What is
Yes.
PRP? Why is PRP?
So PRP, what it is platelet-rich plasma, where you take your own blood. We withdraw 10 ml of patient's own blood. What we do in this procedure is the blood has red blood cells, white blood cells. From that, we take only the platelets with the help of a machine. Okay, it's a machine centrifugation. We take only the platelets. It will become a golden colored liquid
Oh,
after centrifugation. Why it becomes is it will be like filled with growth factors.
okay.
Only the growth factors we are like injecting into your scalp. So what this growth factors does it will help your hair to grow back quickly, and
Okay.
the hair will go from this resting phase to the growing phase. So you'll see a lot of baby hairs coming up.
Oh, that's the reason why people are all back of
Yes,
PRP,
PRP
PRP.
is basically platelets,
Okay.
which will have concentrated growth factors in it.
So is this healthy?
Yeah, it's very healthy
It's very
because we
healthy.
take your own blood. The side effects is also less, and it increases your hair health as well. It'll increase your volume. It'll add shine to your hair. It'll prevent the patient from to go into balding as well.
Oh, nice. Is this procedure can be done again and again, or you
Yeah,
have
usually.
particular time to be done?
So this procedure, how we prescribe is every month it can be done.
Oh, nice.
Usually we prescribe them 6 sittings to see the effect. After that, the patient can go for a break with just supplements and serums, and they can take it like after like a 6 month break.
Oh, nice. Then it is also like a procedure to be done like every month or every week.
This coming to hair and skin, we need maintenance always.
Oh.
After doing one session, we can't expect lifelong results.
What about any side effects that this PRP causes?
So this side effects, as in the patient is just going to have like a mild burning sensation when you prick, mild pain, but there are no side effects as such.
So, what else procedures you have or treatments we have for this hair falls?
Hair fall, how we correct it is usually with the help of growth factors. Just like PRP, we have a more advanced treatment that's called the growth factor concentrate. So, what this does is, again, the name itself says growth factor concentrate, more concentrated growth factors. Again, we take blood and inject it with the help of small syringes in your scalp. We follow a different course for the centrifugation process. And one more we have is without taking blood, we have something called the QR678, where
Oh.
we inject plant derived growth factors in your scalp.
Oh.
So there's no specific course like 3 sessions we do this, 1 session we do it. Depending on your scalp health and depending on your hair fall, we suggest a course for the patient, and it's always not a single treatment. Always we go for a combined approach.
So when we have this hair loss problems, usually we have lot of tests, as you said. So is there any particular blood test or any particular test that can be taken?
So yeah, for Indian women, we prescribe these tests which usually find out the cause. It will be one of these causes. We have 5 tests. One is we can do vitamin D.
Oh.
Usually, it will be vitamin D for Indian women. That too, after childbirth, it will be most commonly vitamin D, calcium, vitamin B12, thyroid levels, and serum ferritin. These are the 5 tests which has to be done if a patient is facing hair fall.
Okay, so every before you we consult, you do take this test, or after the consultation you take this
After
test?
the consultation, we take these tests.
Okay, requiredly for what, which patients, what
Yes,
test can be done?
yes.
Okay.
After taking the test, we see the levels and we correct these levels. When we correct these levels, usually the hair fall comes to normal.
Oh, nice.
Yes.
And also the treatments are basically done on these tests.
Yes, treatments are done on these tests. That's why we tell the patients not to self medicate without knowing the cause. If they keep applying over the counter medications like serums or tablets, it's not going to work. When your vitamin D levels or calcium levels are low and you keep doing other things, it's not going to stop your hair fall.
Okay, so I think so before taking any self care for ourselves, it's better to
Yes,
meet doctors when it
for
comes to
sure.
hair. So I think so, doctor, you've given lot of information about hair fall, and I think so lot of people will take this note, and it'll be helpful for them to consult a doctor rather than taking self care routines. So thank you so much, doctor, for letting us know what, how, and why, and what are the reasons for this collagen. And this name is something that is going to go around everywhere for each and every female who's going to see this broadcast today. And a lot more to talk about hair, health, and skin and lifetime routines in today's broadcast in colors. So let's see.